Delivered from Bunkyoku Researchers Zukan. Hello, let's start the Researchers Zukan. I'm Nipio. Okay. Sorry.
And I am Moazzam Ali.
Thank you. In this program, I introduce you researchers in various fields from all over the universe every day. Today's researcher is Ali Moazzam. Nice to meet you.
Nice to meet you, and hello everyone.
Yeah. Okay. Today's key phrase are these three. Okay, first key phrase, mental health. Could you explain this key phrase?
Yes, these days I'm working on a research which is focused on the mental health ailments, especially in those areas which are struck by some kind of disasters. Basically, I'm working with the survivors of the disasters, such as earthquake survivors or flood survivors. Currently, I'm focusing on Pakistan, where, as we all know, a very big earthquake struck with an intensity of 7.6 at Richter scale. So I'm working with the survivors regarding their mental health issues.
Okay. What is the important point in your research?
I think one of the most important things is that currently we don't have any data on the mental health burden of disease in Pakistan after the earthquake. So what I'm currently trying to do is to look at what is the current magnitude of burden of mental health illnesses in Pakistan, what is the severity, for example, how many people are suffering from the post-traumatic stress disorder and depression, for example, and how are we going to reorient our mental health services to reach the poor people especially. Because what happens is that compared to other diseases such as injuries or heart attacks, the patient knows about the disease by him or herself, that I have this disease. But mental health is a different area in which normally other people tell you that you have this kind of problem. So as a result, many people don't know what is wrong with them, and they keep on living their life with depression or any kind of post-traumatic stress disorder, and ultimately they lead a poor quality life. So I think the different point in my research is that I am trying to reach those people, especially the poor communities, who have not only problems regarding monetary access, but also comparatively less educated than the people living in urban areas.
What method do you use in your research?
Basically, I'm a field researcher, and I go to the communities and I collect data from them and interact with them. And basically, whenever I have when the research is complete, then I share my findings with the policymakers and try to discuss the implications of the research with them and try to see if it can be implemented in the field and in the policies also.
Okay. What part of your research entertains you the most?
I think being a researcher, I really enjoyed working in the communities and interacting with them and communicating with them, trying to understand their viewpoint regarding various health issues which they face. And I think it's very important to interact with the community to understand deeply why people behave about a particular disease in a very typical way. So I think the best part of the research is when I'm in the community, when I talk to them, and I also try to, while talking, try to remove some of the misconceptions, some of the rumors which they have regarding any health ailment, and trying to clear whatever questions they ask me. So I think that is the most interesting part.
Oh, it's very interesting. Okay, let's move to the second key phrase. Okay. Second key phrase is implementation of social franchise.
I think this is a very interesting area, social franchising. But before we go into the definition of the social franchising, it is important to understand why this keyword has come in. Little background is that in most of the developing countries, especially in Asia and Africa, in many countries, majority of the population goes to the private sector, around 70 to 80%. For example, there was a study in India and Bangladesh, and they found that majority of the population goes to the unqualified practitioners. Even they are not medical doctors, but people still take the services from them. In Pakistan, for example, 80% of the outpatient are seen by the private sector, not by the government sector, which is the public sector. And similarly, in African countries, it was found that the main healthcare provider are the pharmacy vendors in those countries. So the role of the private sector is very important because majority of the population are going there to get the services. Now, keeping that in mind, there are many issues in the private sector, such as the quality of the services, the pricing of the services, which many people cannot afford, and the quality is also sometimes good, sometimes very, very bad. So, based on these issues, a new concept of social franchising was developed. Basically, it comes from the commercial franchising. Commercial franchising, as we all know, and we have seen many franchising such as of McDonald's, of KFC, or many other branches of different companies. The bottom line is that they offer a typical kind of services with a certain amount of quality in them, with a special brand name, such as McDonald's. Similarly, when the principles are the same, when we move to the health sector, the commercial franchising is called social franchising. So this is the main idea that in social franchising, the same methods are used, but the main goal is basically social gains, such as improvement in health, rather than financial gains like in commercial market.
Social gain.
Yes, social gain.
Okay. What is main concept or most important point of social franchising?
Social franchising is basically, like I mentioned earlier, is using the main concept from the commercial franchising. What they do in health sector is they form network of the private practitioners and who offer a standard set of services under a special typical brand name. For example, let me give you a couple of examples. For example, in India, there is an NGO which is doing the social franchising in some of the rural areas, and they are using a logo of a flower. So all the practitioners who join the network of practitioners are given a flower logo which they put on their clinic, and the NGO then advertise on the television, in the newspaper, in the radio, that if you want to get the good quality services, for example in tuberculosis or in malaria, go to the clinic with a flower logo. Similarly, in Pakistan, we have a very big network of social franchising in family planning and reproductive health. It is called Green Star. So what they do is they give training to the private practitioners who are in the network, and then they advertise on the television, in the newspaper, that if you want to get good services in family planning and reproductive health, please go to the clinics with Green Star. So there are many examples in different countries.
It's very unique concept.
Yeah, it's very, very unique because with the help of social franchising, not only are we improving the quality of the services, we are also trying to keep the prices of the services to a minimum so that poor people can afford the services. And ultimately, because of advertising, the utilization of the access of is also increased to the communities. So improving the quality, retaining the price, and increasing the access and utilization of the services. All this occurs with the help of social franchising.
Is social franchising applicable in health health system.
Definitely it is, although there are many problems relating to social franchising, but it is applicable. Like I mentioned, in Pakistan we have in family planning. In Myanmar there is social franchising of tuberculosis and malaria, and in India it is also for family planning, for essential drugs. So all these areas social franchising has been implemented and quite successfully.
Okay, let's move to third key question.
Alright.
Career as a researcher.
Yes, I am basically a medical doctor, and after doing my medical graduation, I joined a hospital and worked there as a medical officer for a few years. But then although it was very challenging to treat the patients and deal with them one-to-one, then I found public health, rather I would say research, more interesting, because in clinical side I was dealing with one patient, and in the research I was basically looking at the populations, the problems they face, the kind of diseases they have, and with the help of research we could find some good answers. So that's how I just shifted from the clinical side to the research side, which is the public health. So I think I find it more challenging and more interesting.
Oh, yeah, very interesting. Okay, when do you feel your research meaningful?
That's a very important question. I think research becomes meaningful when it gives you a very tangible outcome, when it gives you an answer to a question, and more importantly, if you are able to communicate this finding to the policymakers. That is more important, because getting the result is one thing, but as an individual, you cannot bring about change in a country. You need to work together with the policymakers, with the health managers. So I think it becomes meaningful when you work in two tiers. For example, from one direction, you try to negotiate and communicate with the policymaker and health managers about the finding of your research, how it can be implemented in the field, what are the benefits, what are the advantages, and at the same time you have to use another way, which is the publication at international level. Because sometimes for an individual it is quite difficult to communicate or properly get the idea through to the policymakers because of bureaucratic problems. So if you publish in international journals, then of course there are other agencies like United Nations, like UNICEF, WHO in the United Nations setup. When they read the findings and if they find it interesting and useful, they put pressure on the policymakers. So you have to use direct and indirect technique, directly communicating and indirectly through publication, to reach your final goal, which is to give benefit to the community from where you have taken the data.
What do you think you will be doing in 10 years?
Quite difficult. I think what I would like is, I've just started my career in public health. It's almost a few years now. But I think in the next 10 years, I would like to be in such a position, progressively going upwards, where I can take some decisions which can be implemented and which can bring about positive change in the life of the communities. Right now, although I'm working as, for example, assistant professor here, the say is very limited. I can publish, I can talk to the policymakers, but I cannot implement. So I hope that in the next 10 years, maybe I'll move up the ladder and I'll be in such a position where I can really talk to the policymaker and bring about really some positive change in the life of the communities.
Oh, that sounds very good. Okay, Thank you. It's time to go now. Thank you very much.
Thank you very much.
Okay, that's it for today's Researchers Gun. See you tomorrow. Bye bye.
Bye bye.